That peel you bought online, it might be the reason your skin is darker now. Yes, post-inflammatory hyperpigmentation from a chemical peel is one of the most common things I treat. And almost every time it was entirely avoidable. Someone bought a peel online or got it done at a salon and came out with skin that was darker, more uneven, or more sensitive than when they started. They did not use the wrong product carelessly. They used the wrong product for their skin, and nobody told them there was a difference. In this episode of Down to Details, let's get into why that happens and how a chemical peel done by a dermatologist in a clinical setting is different. Let's start with what a chemical peel actually does in the first place. A chemical peel works by applying an acid to the skin surface at a controlled concentration for a controlled amount of time to deliberately cause a superficial injury. That injury triggers the skin's repair response. The cell turnover accelerates, collagen production goes up, and the skin that is replaced back is fresher, more even, and better textured. The key phrase there is controlled. The depth of the peel, how far into the skin the acid penetrates, determines the result. Too superficial and you get very mild results. Too deep and you can get damage like hyperpigmentation and scarring. And most people have no idea which one they are getting. What controls depth? Three things: the type of acid, the concentration, and the pH. Most people focus only on the concentration, that is the percentage number on the label. That number alone tells you very little. A 30% glycolic acid at a high pH behaves very differently from a 30% glycolic acid at a low pH. The pH determines how much of the acid is in its active form at any given moment. Two products with identical percentages can have completely different penetration depths depending on their pH. This is not information that appears on a pharmacy label. You read the label, you followed the instructions, and still your skin paid for it. Now, why does this matter specifically for Indian skin? We are back to the Fitzpatrick scale. Majority of Indians fall in types 4 and 5 with naturally higher melanin concentration in the skin. And melanocytes, the cells that produce melanin, are highly reactive in darker skin tones. Any injury to the skin, including a controlled one like a chemical peel, can trigger those melanocytes to overproduce melanin as part of the inflammatory response. This is post-inflammatory hyperpigmentation. You just used a peel trying to fix your pigmentation, but ended up making it worse. That's the cruel irony. Most people getting a chemical peel are trying to treat pigmentation in the first place. But a peel that goes too deep or uses the wrong acid for that skin type can leave the skin significantly darker than it was before the treatment started. This is not a rare complication. It's a predictable outcome when the selection is wrong. And at a salon or with pharmacy product, the selection is almost never based on your specific skin type, your skin's current condition, or your history with previous treatments. The person who did your peel probably had no idea what your skin actually needed. Meanwhile, in a clinical setting where we are performing your chemical peel treatment, we determine the peel before any acid touches your skin. We assess your Fitzpatrick type. We look at your skin's current barrier condition because a compromised barrier and a peel is a very poor combination. We ask about your recent sun exposure, your current skincare routine, any active breakouts or inflammation, your genetic history, and your health status, and also consider your previous treatment history. Then we select the acid type based on your specific concern. Salicylic acid for active acne and oily skin. Since it is oil soluble, it penetrates the follicle. Mandelic acid for sensitive or darker skin tones. Since it is a larger molecule, it has a slower penetration with lower pH risk. Lactic acid for dry or sensitive skin with a compromised barrier. TCA for deeper resurfacing in controlled, experienced hands only. These are not interchangeable. And then we do a patch test. A salon peel follows a set menu, while a clinical peel follows your skin. There is no one-size-fits-all peel. If you've used a pharmacy peel or had a salon peel and noticed increased darkening, redness that lasted more than a few days, sudden sensitivity, or uneven patches, that is your skin telling you the peel was not right for it. The damage is treatable, but it adds time, cost, and sessions that would not have been necessary with the right selection from the start. Fixing a bad peel costs more in time, money, and sessions than doing it right the first time. So, Dermat or DIY for chemical peels. A pharmacy peel at the right concentration for the right skin type, used correctly, can maintain results between clinical sessions. It is a reasonable tool in the right hands, which means hands that know exactly what skin type they are working with. For anyone with Fitzpatrick IV or V skin, active pigmentation concerns, or skin that has reacted badly to a product before, a clinical assessment before any peel is not optional. It is the difference between a result and a problem you now need to fix. Now that you know what your skin actually needs, you're in a much better position to make the right call. Whether that's putting down the product or booking a skin assessment to understand exactly what will work for you. The link is in the description.